weeks by the checkout stand, but the latest cover of Newsweek says, quote, "The recession is over." I bet you found this news a little startling. I know I did. Because obviously people are going through a tough time all across the country. What is true is that the economy has stopped going through the free fall that we saw at the beginning of the year. When I took office, we were losing jobs at nearly double the rate that we're losing now. So we may be seeing the beginning of the end of the recession. But as I said before, that's a little comfort to the folks who lost their jobs and haven't found another. Now, a lot of this is going to take time to complete. And it's not solving all of our problems all at once. But we are stabilizing this economy and moving it forward in part because of the actions that we're taking. We're not going to rest. I'm not going to rest until everybody who wants to find a job can find a job. But there's little debate that the steps that we've taken in the first 6 months help to stop this economic freefall. I've got to admit, when I hear some of the critics talking about out-of-control spending, I can't help but remember those are the same critics who contributed to the $1.3 trillion deficit that I inherited when I walked in. They basically handed me a bill for $1.3 trillion. I said, here, fix it. And now they're on TV saying, why haven't you fixed it yet? In the middle of the greatest recession since the Great Depression. So we've got to keep this in perspective. People feel like they've got to cut back. Why shouldn't government have to cut back as well? Is now really a time for government to weigh in and try to do something about health? I think it is. And let me tell you why. Part of the reason that we're doing this town hall here at Kroger is because Kroger provides health insurance to its associates, as many as it can. And that is significantly different than a lot of companies out there who aren't providing health insurance for their employees. In some cases, it's not because they don't want to, it's because they can't afford it. We spend $6,000 more per person on health care in this country than any other nation on earth. We're not getting a good deal for the amount of money that we're spending. I won't name any names, but I think it's fair to say that there's some Kroger's competitors that aren't providing the same levels of health care. That undercuts your business, but it also means that those folks, a lot of times they're going on Medicaid, which you pay for out of your taxpayer dollars, or they just don't have health insurance and they show up at the emergency room to get care. And the hospitals, because they've got all this uncompensated care, they jack up everybody else's insurance premiums to help cover their costs. No one is talking about a government takeover of health care plans. As I was driving up, I saw some signs. Folks were all wound up. They're listening to certain radio programs and watching certain cable shows. So somehow I guess they think we're just going to take over health care. I tried to say this over and over again. If you're happy with your health care, you're happy with your doctor, we're not going to force you to change it. Kroger is providing health care to its employees, then we're not going to change that system. What we are going to try to do is work with Dave and others to see if we can control the costs so that they can keep on providing health care at an affordable cost to all of you. If we do nothing, then I can guarantee your premiums will go. More and more people will lose coverage. Business profits will be constrained, which means that they will be able to hire fewer people. And our federal budget is going to go up. And you should know that the same arguments that you're hearing now about health care reform, you were hearing back then about Medicare. Everybody was saying, this is socialized medicine, the government's taking over, this is terrible. Now the senior citizens will tell you they are very satisfied with Medicare, except for one exception, and that is prescription drugs. Any plan that we have has to have prescription drugs as part of it, because that's a bigger and bigger part of the health care system. And the deal that we need to strike with the drug companies is, look, you're now going to have a whole bunch of new consumers. You've got to cut a better deal. for those customers, so that they're not 3 months or 6 months into the year suddenly having used up their entire benefit. Thank you very much, everybody.